Hello good people, welcome back to my YouTube channel. It's been a while but now we're back. I'm here with my friend Lilian Mora Wasike. Go to her channel and subscribe and follow her for such nice and educative medical content. Yes. Follow us through this video and get to learn more about the topic she'll be discussing today is cervical cancer.
Yes, my YouTube channel name is Lilian Mora Wasike. Please don't forget.
Subscribe, like, share her content. She's a good one. Yes, let's get into the video.
Hello guys, my name is Lilian Mora. I'm a clinician, a businesswoman, a mother, and a wife. So, before we continue, I beg, please, my YouTube channel is called Lilian Mora Wasike. You can go down there, click the ring button and subscribe. So today we are going to talk about cervical cancer. I know this is a condition yenye imekuwa ikisumbua a lot of people na hakuna mtu amekuwa akikama out to talk about it, but I've taken this initiative to come and talk about it because it's a condition that has been affecting so many women in Africa. So, what is cervical cancer? Cervical cancer is a type of cancer that usually affects the cervix. So, the cervix, labda watu wengi mnajiuliza cervix ni nini? Cervix is a part of a reproductive organ that is usually found in the female reproductive organs. So it is a organ that usually connects the uterus and the vagina. It's normally found under the uterus and also connects the vagina. So there are two types of cervical cancer. Moja inaitwa squamous cell carcinoma and adenocarcinoma. The squamous cell carcinoma usually invades the squamous cell of the cervix. And the other one, adenocarcinoma, usually affects the canal of the cervix. The cause of the cervical cancer is normally caused by a virus called HPV. In full, human papilloma virus. It's a virus and a lot of times, sana, the virus ina affect the cervix na immune system ya mwili ina try kuifight for so many years. However, sometimes inaweza jimanifest later in life. Now, we've talked about the types of cervix, the cause. Now we are going to talk about the risk factors. Which factors zinaweza lead a female human being kuwa na hii cervical cancer? One factor, it is multiple sexual partners. I think you understand what I mean. STIs, sexual transmitted infections, for example HIV, gonorrhea, syphilis and chlamydia. Another risk factor is having sex, engaging yourself in sexual habits at a very early age. Another risk factor is smoking. Being married to a man who has penile cancer or prostate cancer can also cause. It's also a risk factor. Another cause is immunodeficiency conditions. So human immunodeficiency conditions, for example HIV, can also be a risk factor to cervical cancer. Also, history of a cancer in the family can also be a risk factor. But before we go to prevention, how can you manage the cervical cancer? One, after you get the cervical cancer, there are many stages. There is stage 1A, stage 1B, 2A, 2B, like that, mpaka stage 4. So management depends with the type of stages that uko nayo. So those ones who usually have stage 1, from stage 1A to stage 2A, they can undergo surgery depending whether they are still fertile ama they still need kids, because kuna some part za reproductive organs zinaweza tolewa. And then for those ones who have stage 2B mpaka stage 4A, they can undergo chemotherapy, radiotherapy, both chemotherapy and radiotherapy, and sometimes surgery. And then if you are uko na stage 4, umefika stage 4, hakuna kitu yote yenye inaweza fanyika, maybe palliative care. I think you understand what I mean by palliative care. Feeding well, kuangaliwa, because at that time inakuanga imefika terminal. So prevention, number 1, prevention, you can unaweza prevent cervical cancer by getting HPV vaccine. Number 2, routine pap smear tests for female who are above 21 years. And number 4, practice safe sex, because at first nimeongelea risk factor ni sexual diseases, for example HIV, gonorrhea, chlamydia and syphilis. So if you want to prevent yourself from getting the cervical cancer, you have to protect yourself by using maybe condom when you are having sexual intercourse. And then another one is don't smoke. And if you are smoking, you can visit a nearby doctor mwenye ataku advise on how you'll have to stop smoking. Another thing is that for those ladies who are still underage, they can still abstain from sex mpaka at least wakuwe, because the risk factor yenye tumesema is engaging yourself in sexual matters at a very early age. Okay, I think at least kila mtu amepata knowledge about cervical cancer, though we have not talked into details, but at least there is something umepata. So if you have any question, you can comment down there on my YouTube channel. And if you want us to talk about any other condition and ungependa kujua, please let me know. And please share, subscribe, and also bye next time. So beautiful people, we've already discussed about the cervical cancer. Please let me know how was my presentation. If I need to nafako at least
maybe some correction somewhere, you tell us.
Yeah, you tell us.
Yes.
Some
Comment down below in the comment section.
Yeah.
And don't forget to like, share, subscribe to her channel, Lilian Mura Wasike.
Yeah.
And also subscribe to this channel if you're new here, Nerea Nerei.
Yes.
Thank you for your audience.
Yeah.
Bye-bye.
Bye.